And I'm not knocking the drug companies. I'm really more knocking the countries than the drug companies. But starting today, the United States will no longer subsidize the health care of foreign countries. The European Union has been brutal. You got me. Before I do, I'll sign one of the most consequential executive orders in our country's history. I don't think there's ever been anything signed like this, certainly not with respect to health care, nothing even close. I'm delighted to be joined on this occasion by Secretary of Health and Human Services Robert F. Kennedy Jr., who is doing a really good job, I have to tell you that. CMS Administrator and a friend of mine, Dr. Mehmet Oz, who is an amazing guy. You know, I was telling Bobby before, Oz had a very successful show, but it hurt his reputation. Because when you're in show business, it hurts your reputation a little bit. It's good for you, but in terms of professionalism and being a doctor, it sort of hurts your reputation. This guy went to the best schools, was the best, top of the line. Then he did a television show, became a success, made a lot of money, all that stuff, but it sort of hurt him. And you know who I compare that to? I hate to say this, but a special woman, Jeanine Pirro. She was the toughest, smartest DA, maybe in our countries, in our cities and states, history, New York. She was really tough, really sharp. Then she did a show, and people didn't think of her quite the same way. She became more of an entertainment person, like Oz. Oz is not an entertainer. He's not really an entertainer, if you know the real story. And she isn't either. She is unbelievable. She was one of the strongest district attorneys in the history of New York, highly respected, very tough, went after the drug dealers at a level that you don't see today anymore. And hopefully she's given up she's leaving the #1 show on cable television, one of the #1 shows on television, period, The Five, but they've got great people left behind, but she was a big part of it. And so I equate it to that. Jeanine Pirro is unbelievable. FDA Commissioner Dr. Marty McCary, with a reputation that's second to none, and the job he's doing already has been fantastic. Thank you, Marty. And Director of National Institute of Health, Jay Bhattacharya, who has been, as you know, from Stanford, so highly regarded, and have all been working with us very hard on this. And the question they would ask, being a little bit new to the government aspect of it, is why doesn't somebody fight the drug price situation, meaning equalization? There's a term, it's called equalization. Nobody wants to mention that term. And I'm not knocking the drug companies. I'm really more knocking the countries than the drug companies, because they're forced to do things. But the drug lobby is the strongest lobby in this country, they say, the drug lobby. It's between that and lawyers, and they have a lot of power. But starting today, the United States will no longer subsidize the health care of foreign countries, which is what we were doing. We're subsidizing others' health care. Countries where they paid a small fraction of what, for the same drug, that what we pay many, many times more for, and will no longer tolerate profiteering and price gouging from Big Pharma. But again, it was really the countries that forced Big Pharma to do things that, frankly, I'm not sure they really felt comfortable doing. But they've gotten away with it, these countries. European Union has been brutal. And the drug companies actually told me stories. It was just brutal how they forced them. And European Union suing all our companies, Apple, Google, Meta. They're suing all of our companies. They end up, they have judges that are European Union-centric, and they get rewarded $15 billion, $17 billion, $20 billion, and they use that to run their operation. Not going to happen any longer, that I can tell you. So what's been happening is we've been subsidizing other countries throughout the world, not just in Europe, throughout the world. European Union was the most difficult, from what I understand. I'll tell you a story. A friend of mine who's a businessman, very, very, very top guy. Most of you would have heard of him. A highly neurotic, brilliant businessman, seriously overweight, and he takes the fat shot drug. And he called me up and he said, President, he calls me, he used to call me Donald, now he calls me President, so that's nice respect. But he's a rough guy, smart guy, very successful, very rich. I wouldn't even know how we would know this, but because he's got comments. President, could I ask you a question? What? I'm in London, and I just paid for this damn fat drug I take. I said, it's not working. He said, I just paid $88. And in New York, I pay $1,300. What the hell is going on? He said, so I checked. And it's the same box, made in the same plant, by the same company. It's the identical pill that I buy in New York. And here I'm paying $88 in London. In New York, I'm paying $1,300. Now, this is a great businessman, but he's not familiar with this crazy situation that we have. But he was stunned. But it was just one of those stories. And I brought it up with the drug companies, represented by somebody who's very, very smart, good person too. And we argued about it for about half hour. And then finally he just said, because they can't justify it, he just said, look, you got me. You got me. I can no longer they've been justifying this crap for years. They said, oh, it's research and development. Well, I said, well, research and development, other countries should pay research and development too. It's for their benefit. It was just one of those things. And the other countries would set a price, and they'd meet the price, and they'd say, if you don't meet the price, you can't sell it in our country. I said, well, then you walk away, and they'll call you back and they'll sell it in the country. But now they'll have to do that. So for the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. Drug prices will come down by much more, really, if you think 59. If you think of a drug that is sometimes 10 times more expensive, it's much more than the 59%. It depends on the way you want to analyze it, but in one way you could analyze it that way. But between 59 and 80, and I guess even 90%. So when I worked so hard in the first term, and if I got prices down, remember I was the only one to ever get prices down for a full year, but I'd get them down like 2%, and I thought it was like a big deal. Well, we're getting them down 60, 70, 80, 90%, but actually more than that if you think about it in the way mathematically. And Pharma has to say, we're sorry, but we'll not be able to do this any longer to these countries that have been so tough. They've been very tough, nasty. It's trade. And pharma is also very powerful. And the Democrats have protected pharma. This is the Democrats have protected pharma. These are the Democrats. And by the way, I just called the Speaker of the House, and I just called the leader, our leader in the Senate, John Thune, Mike Johnson. Spoke to both of them. I said, when you score, you're going to have to score two things. You're going to have to, number one, score that hundreds of billions of dollars of tariff money is coming in. But even bigger than that, you're going to have to score that your cost for Medicaid and Medicare and just basically pharmaceuticals and drugs is going down at a level that nobody has ever seen before. It'll pay for the Golden Dome. I see the Golden Dome is there, see? That'll easily pay for the Golden Dome. And we'll have a lot of money left over. We need the Golden Dome, by the way, in this world. Although this world's a lot safer today than it was a week ago, and a lot safer than it was 6 months ago. We had people that had no clue what they were doing. So today Americans spend 70% more for prescription drugs than we spent in the year 2000. Think of that. Our country has the highest drug prices anywhere in the world by sometimes a factor of 5, 6, 7, 8 times. It's not like they're slightly higher. They're 6, 7, 8 times. There are even cases of 10 times higher. So that you go 10 times more expensive for the same drug, that's big numbers. Even though the United States is home to only 4% of the world's population, pharmaceutical companies make more than 2/3 of their profits in America. So think of that. With 4% of the population, the pharmaceutical companies make most of their money, most of their profits from America. That's not a good thing. Now, I think, by the way, I have great respect for these companies and for the people that run them. I really do. and I think they did one of the greatest jobs in history for their company, convincing people for many years that this was a fair system. And nobody really understood why, but I figured it out. For years, pharmaceutical and drug companies have said that research and development costs were what they are, and for no reason whatsoever. They had to be borne by America alone. Not anymore, they don't. This means American patients were effectively subsidizing socialist healthcare systems in Germany, in all parts of the European Union. They were the toughest of all. They were nasty.